Good evening, everybody. I'm just going to give you a brief talk on the conditions associated with obesity and how it resolves after the surgery. And some of you may already have many of these medical conditions. Um, some of you already had surgery and might have already seen how it resolves some of your medical conditions, or what we call as comorbidities are resolved after the surgery. And as you can see here, there's a big list of conditions that are associated with uh, obesity. And the first and the topmost one is type 2 diabetes, blood pressure, hyperlipidemia or high cholesterol, respiratory diseases, sleep apnea, depression, menstrual irregularities, urinary incontinence, asthma, certain type of cancers. You're at risk for certain pancreatic cancer, stomach cancer, ovarian cancer, prostate cancer, so on and so forth. And I'll explain in more detail later on. It's associated with increased reflux disease, joint pain, arthritis, heart disease. You have increased predisposition for developing gallstones, uh, infertility, and polycystic ovaries. Um, Now, if you look at the trends in obesity, and if you look at where the uh, prevalence or the presence of most of the obese population is, this is how it is. As you can see, the darker shade basically represents areas where there is a lot of obesity people whose BMI most of the time is about 35 or so. And if you come down, and they did a study on where the prevalence of diabetes was, and it followed exactly the same path. That is mostly in the Midwest and the southern part of the country. And if I go back to the same slide, that's also exactly where most of the prevalence or the incidence of diabetes and obesity was. Now, what happens to, let's start with polycystic ovary. What happens to polycystic ovarian syndrome after surgery? Most of the time, uh, it is significantly alleviated. Most of the time, it resolves after surgery. There is a lot of depression that is associated with polycystic ovaries, and that also improves after the surgery. So what happens to sleep apnea? A good majority of patients who have obesity, especially severe obesity, BMI above 40, they have often associated sleep apnea, for which they might be using a CPAP machine. At 1 year, studies have shown at 1 year, if you do a gastric sleeve, about 80% of those patients will have a resolution of the sleep apnea, which means essentially they can get off their CPAP machine. And likewise for gastric bypass, it gives a very good resolution rate, about 87% resolution rate with gastric bypass. Non-alcoholic fatty liver disease, it is also called steatohepatitis. And as of now, this is the #1 reason for liver transplant. The highest reason, or the vast majority of liver transplants that are done in the country today, is because of non-alcoholic fatty liver disease or steatohepatitis that is often associated with obesity. After surgery, it is almost complete resolution of this liver problem. And this is the reason why we also put you all put the patients on protein shake. That's basically to shrink the liver, to get the fatty liver under better control, so that it shrinks to a little more smaller size or normal size, so that we can do the surgery. The recent studies have also shown that there's a lot of cancers that are associated with obesity. And as you can see, it's a big list, and this list seems to be kind of increasing as time goes by. Esophageal cancer, colon cancer, rectal cancer, multiple myeloma, non-Hodgkin's lymphoma, melanoma, breast cancer, uterine cancer, prostate cancer, stomach, liver, and it's a big list. Gallbladder cancer, ovaries, and once you have the surgery done, how, the incidence of these um, of the cancer decreases significantly after surgery for obvious reasons, because it is the fat within the abdomen that predisposes to cancers, and that cancer risk is reduced when that fat level is reduced within the body. Now, how can surgery help? It with regard to all other medical conditions like diabetes, blood pressure, cholesterol, so on and so forth. Now, with regard to your diabetes, what are the chances that you will have resolution or complete resolution of your diabetes? If you do the bariatric procedures, the chances that you will have part resolution of your diabetes is about 77%. Sorry, other way around. It's partly resolved is about 86%. Complete resolution is about 77%. I repeat, if you have a bariatric procedure, the chances that you will have your diabetes resolved or partly resolved is about 86%, and the complete resolution is 77%. The second thing is blood pressure or hypertension. Partly resolved or complete resolution is about 79%. Complete resolution alone is about 62%. Likewise, sleep apnea, as I showed you, 86% and 84%. And cholesterol, 72% resolution rate. As you can see, most of these numbers are more than 70 to 80% resolution rates after surgery. And this is what is going to give you longevity and a quality to your life, in addition to the weight loss benefits that you will definitely feel after surgery. What happens to the medical conditions after each individual procedure? This is for the band. I don't know how well you can see. The band, of late, we don't do it. Most places don't do lap bands for many reasons. As you can see, it gives about 47% resolution rates for diabetes. It gives about 71% resolution rate for blood pressure, about 38% resolution rate for cholesterol, and about 94% resolution rate for sleep apnea. Likewise, for the gastric bypass, it gives about 83% resolution rate for the gastric bypass, about 93% for the blood pressure, and 75% for cholesterol, 86% for sleep apnea. Sleep, similar rates, 59%, 78, 49, and 90% resolution rates. Duodenal switch, 97% for diabetes, 99% for blood pressure, 81% for cholesterol, and 95% for sleep apnea. Again, as I told you earlier, all of them shows a significant resolution rates after surgery. And this is what essentially prevents you from getting a heart attack or a stroke or kidney disease, and essentially adds a longevity to your life. And now there was a study that was done on nearly 8,000 patients, and they followed up these patients after gastric bypass for 8.5 years, and they found that the overall mortality or the death rate reduced by 40% after the surgery was done. As you can see here, and this is across the spectrum. The heart-related death rate was reduced by 56% in the patients who underwent bariatric procedures. It also reduced obesity-related cancer rate. I listed a big list that of the cancer caused by obesity or related to obesity, and all of them has shown a significant reduction in the rate of the cancers that are seen in obese population. The diabetes-related death rate was down 92%. This is a big number, and this is what the cardiologists love. If you have diabetes and heart disease, they would love for you to have a bariatric procedure because it will control your diabetes, and because of that, it will also reduce the risk factor for a cardiac event. If you're ready to make the change, please call us. Our office number is 816-254-9292, or you can find us online on kc-weightloss.com at kc-weightloss.com.